joining us today on this webinar. In less than 4 weeks, hundreds of thousands of Virginians will have the opportunity to purchase quality, affordable health insurance through the marketplace. While this is a great opportunity, many consumers will need assistance enrolling, and that's where you all come in. Our presentation today will walk us through 4 key questions for all of us to consider. First, for some brief background, I will cover what is happening with the marketplace. Second, I will outline the 3 opportunities for consumer assistance. Next, Tricia Brooks, our special presenter, will provide details on what CACs do and how you can become a CAC. And last, I will outline some of the next steps that everyone can take to help strengthen health reform in Virginia. So what is happening under the Affordable Care Act, or the ACA? In just 25 days, Virginians will have the opportunity to choose from an array of private health plans made available through a new health insurance marketplace. In this new marketplace, health insurance companies cannot deny coverage to someone with a pre-existing condition, nor can they price plans based on health status or gender, and they are restricted in pricing policies by age. All options in the marketplace will include important and guaranteed benefits. Finally, coverage will be made more affordable for consumers through tax credits that will help offset the costs of the premiums, and for some, even out-of-pocket expenses. The marketplace in Virginia is federally facilitated because state lawmakers opted not to have a state-based marketplace. That means the federal government is responsible for managing the marketplace web portal, certifying the plans offered, and selecting the organizations assisting consumers. Now, speaking of consumer assistance, health insurance is complex and can be difficult to understand. People will need one-on-one assistance in order to determine their options. To that end, the U.S. Department of Health and Human Services announced funding awards for 2 navigator entities in Virginia. A call center has been opened, and this month, many training opportunities are available for groups interested in assisting consumers. In Virginia, it is estimated that 624,000 uninsured and underinsured individuals are going to be eligible for tax credits in the marketplace. Individuals and families who earn between 100 and 400% of the federal poverty level can access premium tax credits on a sliding scale to help offset the cost of coverage. Premiums will be capped at a percentage of income. Others can purchase coverage in the marketplace at incomes below 100% or above 400% of the federal poverty level, but they will not be eligible to receive tax credits. Virginia lawmakers have not agreed on when to expand Medicaid, which means that thousands of Virginians will fall into the coverage gap. These are people whose incomes fall in between Virginia's meager Medicaid eligibility thresholds and 100% of the federal poverty line. For parents, this means that if your income is between 30 and 100% of the federal poverty line, you will fall into the coverage gap. So that means they make too much money for coverage under our state's current Medicaid program, but not enough to qualify for the tax credits available in the new marketplace. For adults without children, the gap includes everyone under 100% of the federal poverty line because single adults are not eligible for Medicaid in Virginia, no matter how low their income is. So now let's turn to the 3 opportunities for consumer assistance. So we have new coverage options and many people becoming eligible for private insurance. With these expanded coverage options, there are lots of new terms and concepts that can be very confusing. Some consumers may find this overwhelming, and that's where you all can step in and provide assistance. There are 3 distinct types of assisters: navigators, certified application counselors, and champions for coverage. I will give a brief overview of each and then let Tricia provide more detail about the CACs. As I mentioned earlier, back in August, the feds announced two Virginia's navigators entities, the Virginia Poverty Law Center and Advanced Patient Advocacy. VPLC is a nonprofit organization that serves Virginia's legal aid system by providing advocacy, training, and litigation support on civil justice issues that affect low-income Virginians. Advanced Patient Advocacy is a for-profit entity that partners with hospitals to connect uninsured people seeking care with coverage. These two groups have funding from the federal government to educate consumers on their health coverage options, and then assist with eligibility, enrollment, and plan selection. They will prioritize low-income, disadvantaged, and hard-to-reach populations, and they must provide information to those with limited English proficiency. VPLC has a total of 16.3 navigators. 14.3 of the navigators will be spread out among VPLC and 8 legal aid programs around the state. There are also 2 navigators working through the Young Invincibles. They will be working with the Nova Community College system. Advanced Patient Advocacy will be continuing and expanding their work with hospitals to identify and enroll people who are eligible for health coverage but are uninsured. In addition to the navigators, 22 of the federally qualified health centers in the state have received federal funding to have application counselors on site to help educate and enroll consumers in the marketplace. In total, the FQHCs plan to use the $2.5 million in federal funds for about 65 people trained to help consumers apply for coverage. Very briefly, because Tricia will cover this in much more detail in just a minute, CACs are community-based organizations that are looking to perform many of the same roles as navigators. They will help connect families with coverage, promote the marketplace, and contribute to the overall success of health reform. Champions for Coverage are organizations that want to help with outreach and education. There are many ways to go about this, from sending emails about new coverage options to putting a widget on your organization's website that directs people to the marketplace. Any organization can be a champion, and it can be official or unofficial. If you'd like to be recognized officially as a champion, there is an easy application you can fill out on the Marketplace website. Of the 3 types of consumer assistance, the CAC role will be critical in our state. Federal funding is very limited for supporting the work of paid navigators. That's because ongoing budget stalemates at the federal level, combined with congressional efforts to oppose the ACA, have meant that very limited funding has been appropriated for states with federally facilitated marketplaces. So, having an extensive set of CACs active in Virginia will need to be a key component in connecting people to coverage. So now I'd like to turn it over to Tricia, and she will walk us through the role that CACs can play and how to become a CAC in Virginia's federal marketplace.
Thank you. I'm sorry, everyone. I actually lost my internet connection there, and I think I probably threw everyone into a little bit of a panic, wondering what actually happened to me. But I am here, and I'm going to sort of be going through this with my slides and asking Massey to make sure that I stay synced up with what you're seeing on the webinar. So we'll go to the next slide, which is what are the duties of CACs. And basically, there are 3 fundamental duties. One is that certified application counselors must provide information about the full range of QHP options, as well as the insurance affordability programs, which include Medicaid and CHIP. This is really a critical piece, I believe, in the role of CACs, and it was certainly something that many of us commented on in the federal regs, because we feel that it's important that all assisters be objective and make sure that consumers potentially know about all of the options that are available to them and not just a few select options. In addition to providing information, CACs should be assisting individuals in applying through coverage, regardless of which coverage option they may end up being eligible for. And then once eligibility is established, helping to facilitate their actual enrollment in a QHP or Medicaid and CHIP. So how is this all going to work in Virginia? Wait, I think I missed a page. I'm going to the requirements of CACs. I've got mine out of order. Sorry about that. So what are the requirements that CACs must meet other than doing those three duties that we just outlined? First, CACs must serve the best interest of consumers. They must also comply with the privacy and security standards that are going to be set in the federal marketplace. If they have some kind of a relationship with a QHP, with an insurance company that offers a plan in the marketplace, so for example, if you're a nonprofit organization and an issuer perhaps supports an annual event that you do, disclosing those kinds of relationships will be important so that people are aware of any potential or perceived conflicts of interest. CACs must also complete all of the federally required training, and we're going to talk a little bit more about that in just a few minutes, as well as pass any of the exams that are associated with the different training modules. And lastly, CACs must also be able to either serve directly or refer people with disabilities to navigators and other sources or resources in the community. So there's been, as we have had all these different types of assisters emerge over time that are going to be affiliated with the Affordable Care Act, there have been navigators, you may have heard about in-person assisters, which I don't think we'll be having in Virginia. It's only in states with state-based exchanges. And then certified application counselors. It's been, you know, who does what? What are the differences between them? And the reality is that the certified application counselors will perform very similar but limited functions from navigators. So for example, navigators are required to do outreach, but CACs are not. And CACs are not actually subject to the same stringent conflict of interest standards. So for example, a navigator cannot have any kind of a financial relationship with a QHP issuer connected to enrollment. And a CAC could, but they would have to disclose that, as I discussed just a few moments ago. Also, CACs do not have to provide to meet the culturally and linguistically appropriate standards that navigators have, unless as an organization you have a responsibility to do that under other relationships that you have. Also, navigators have to serve people with disabilities, but CACs can refer them to the navigators or other resources. And lastly, although I'm not sure why CACs wouldn't want to do this, navigators have a requirement to refer consumers to ombudsman programs or some kind of consumer assistance programs that help people who have grievances or complaints with their insurance company. So it seems to me that maintaining a list of those resources is not a heavy lift, but indeed the CACs are not required to do that. So let's talk about the CAC program in Virginia, in particular because Virginia will have a federally facilitated marketplace. So what the federal regulations tell us is that there definitely will be a CAC program in Virginia. And what the federally facilitated marketplace has chosen to do is to actually designate CAC entities rather than certify individual certified application counselors. And that's largely so that they can extend their reach and bring more organizations in by delegating some of the oversight and the screening and certifying of staff and volunteers to these designated entities. The FFM is also going to maintain a registration process and a method to track the performance of CACs. And then if indeed the procedures are not being followed or something else is not going well, then they have to also have procedures to withdraw certified application counselor designation. It's important to know that all certified application counselor entities will be listed on the marketplace. It is on the website. It is my understanding that that's not going to actually be individuals who have been certified, but it will be the entities themselves. And I would certainly, if you are an organization that's considering becoming a designated entity, I would consider if it makes sense for you to offer on your own website a list of individuals who have been certified. And the reason for this is because there's been, you may have read, if you've been following certified application counselors and navigator issues through time, there's been some criticism of these programs by generally people who are not particularly positive about the ACA. And one of the things they complain about is how do consumers know that someone is really certified and trained to help them. And so by providing a list of the people who are actually certified to do this work, it's another way that consumers can check. So it's just something I would invite you to think about. So now that we know that in the federal marketplace that the CACs will be largely entities that are working with the federal government, and then in turn they have responsibilities. What are those responsibilities? Well, the first thing is that the CAC entities will have to enter into a written agreement with the federal exchange, assuring that it as an organization and its staff and volunteers that it ensures gets trained and certified to do this work will comply with all of the standards, particularly the privacy and applicable data security standards. And this is where, again, there's a lot of emphasis at the federal level because one of the big concerns has been brought up is the potential for identity theft and how it's really important that the privacy and security of data be protected. Also, the CAC entity must provide or establish procedures to inform applicants of what the role of the CAC is. So when we sit down to help someone, we can say, here's what my job is, you know, and here's how I go about doing it so that consumers understand what that role is. The designated entities must also make sure that all of the CACs complete the training with a passing grade, that they do disclose any potential conflicts of interest to consumers. And last but definitely not least, you cannot pass on any kind of a fee for helping a consumer get through the application process. So what types of organizations can serve as CACs? Well, the final regulations actually did not specify or restrict the types of organizations that can serve as CACs, at least the ones that the federal marketplace will be designated. They did broadly outline that the federal exchange will be designating organizations that, one, have processes in place to screen staff and volunteers who are certified to ensure that they will protect personal information. Two, that they already are the type of organization where they would have relationships with people who would be seeking coverage. And this is why you see a lot of talk about certified application counselors being healthcare entities or being social service agencies within their communities. And lastly, they should have experience with public benefit programs or other social services programs. So some of the information we've gotten from the FFM, you could go to the next slide, please, gave us examples of the types of organizations that are likely to be chosen as CAC entities by the federal government, and those include a long list of healthcare providers, community health centers, hospitals, primary or specialty care practices, Indian Health Services, Ryan White HIV/AIDS providers, behavioral or mental health providers. So it really was a pretty thorough list of healthcare providers. And then also agencies that have that experience with those social service programs such as SNAP or energy assistance, which could include 501c organizations as well as state and local government entities. And I do want to point out here that it's not a mistake that that does not say 501c3. There are broader classifications under the 501c designation, religious organizations, that sort of thing, some organizations that are not C3 entities. So I just want to make sure that we point that out as well. So how will CACs be funded? Actually, they won't be unless there are some kind of local or state funding available to them. The FFM has clearly indicated that it will not provide funding to CAC entities. However, the regulations also state that CAC entities may receive funding from other sources to support their activities. So let's talk a little bit about what organizations have to do to become a CAC. We did broadly outline it before, but we've given you a link in this slide where you actually apply, and the next couple of screens are going to show you what you'll see when you go to apply. This first language is basically just outlining some of the information I've already shared with you. Next slide, please. Then it goes on to ask you for some basic information about your organization and the type of organization that you are. And then it asks you about contact information for the organization, how the mailing address, phone number, email address of who's going to be the primary contact for the federal government to get in touch with as they're reviewing the application. And then what would be the public information that they would make available so that consumers can actually get in touch with you, and what kinds of, where would be the places where consumers could be served and the hours of operation that they would be available. So what else is involved in the process? It does then actually have some drop-down boxes that you would fill out that basically tell the federal government what kind of entity you are, and if you look at those, you don't see the choices under the drop-down boxes, but it's basically lining it up with the types of entities that I spoke about a few minutes ago. And then it wants to make sure that, that you do have some kind of screening process in place. And I think, again, many organizations, particularly healthcare providers, have other requirements under HIPAA or other laws for privacy and security, and so would already have those in place. So it's asking a little more information about the privacy and security. So that is really what's involved in the process. It's my understanding right now that there's a 2 to 3 week backlog in the federal government reviewing all of the applications. I was told by one federal official to please make sure that in any communications with potential CAC entities that just emphasize the importance of filling out the application accurately and completely before you submit that. this delay does not reflect on the likelihood of you getting approval, and in fact, I think it's not a bad idea for you to think about how you can get a head start, assuming that you are one of those types of organizations that have been outlined as prime for being a CAC. Their copies, it's not the actual web-based training, but they're screenshots of the web-based training. It's 5 modules. We've given you the link there. You can download that, and people can start boning up, if you will, on what's in the content of the training, and be better prepared that once you have your designation, which gives you an ID number, that then individuals can go in with that designated entity ID number and begin the process of going through the training and getting their certification finalized by passing those exams. So what individuals need to do, we've talked a lot about the entities themselves. If you're an individual, encouraging your organization to be a CAC. If you work for the type of organization that would have a natural affinity for this kind of work. Otherwise, you could contact your local hospital or other healthcare provider to offer to volunteer for them, go through whatever their screening process is, and then complete the CAC training and pass the exam. I think this is my final one. You know, there have been, I think, about a third of the states now that have passed navigator laws, but in some states, those navigator laws seem to be have a little broader reach and apply to all different types of assisters. I don't think that Virginia's navigator law impacts the CACs, and the reason for that is that your law is very specific in referring to navigators as those that are actually detailed in the Affordable Care Act under Section 1311. The authority under which the Secretary is approving the use of certified application counselors comes under a different section of the Affordable Care Act. It's 1323, I believe. And because of this very specific reference in the Virginia law to navigators, it would be my non-lawyer opinion that CACs do not come under Virginia's navigator law. And I think, Massey, that is what I was supposed to cover. I'm going to hand it back over to you.
Thank you very much, Tricia, for walking us through those details on the CACs. We really appreciate the expertise that you bring to this. So now I will discuss some of the next steps that we can all take. There are a lot of groups and organizations who are going to be active in this space of connecting people to coverage. These include not only paid navigators like VPLC and APA, but also the FQHCs and groups serving as CACs and champions for coverage. But also key healthcare providers like hospital systems, health plans, insurance brokers, local government social service departments, and other safety net providers will also be involved. A group of many of these stakeholders are currently working to coordinate the consumer assistance activities in Virginia. The goal is to minimize redundancy and identify gaps in assistance so we can get help to where it is needed most. We'd also like to facilitate the connection of individuals interested in volunteering with organizations doing outreach, education, and enrollment work in their area. And we are working to create a way for the various groups who are in this field to assist consumers to share best practices and ask their peers questions. So for example, VCV is partnering with the Virginia Community Healthcare Association to develop training modules for the FQHCs and others who are interested in consumer assistance. The trainings are primarily for health clinic staff that will be providing consumer assistance, but extra space will be made available to those interested in helping. The trainings will also be videotaped and made available through the VCHA website. We are also working with our partners to promote the systematic scientific collection of consumer assistance feedback from the field. We are looking at deploying new tools like the secure online community called In the Loop, connecting the coverage community. In the Loop, which is being developed by Community Catalyst and the National Health Law Program, will aggregate information about the marketplace application so changes can be made to reflect real experience. This tool is set to go live in mid-September. We'd also encourage you to collect stories, data, and information that highlight the success of the marketplace. And when you encounter people who are falling into the coverage gap, please collect their stories as well. For our partners who continue to work on Medicaid expansion, these stories are incredibly helpful in demonstrating the need for expansion in Virginia, and also the need for Virginia to eventually move to a state-based marketplace because, among other advantages, there's a lot more funding available to connect people to coverage. So moving forward with more information, we'd like for you to consider whether your organization will likely become a CAC. We'd also like your organization to develop plans to work with your local FQHC, legal aid offices, free clinics, and other community-based groups to promote outreach efforts and collect on-the-ground information. So now, in a minute, there will be a pop-up window that comes up for a very quick poll asking you if your organization is still interested in receiving additional information on becoming a CAC. If you are, please click Yes in the box. This will facilitate the coordination of the consumer assistance effort going forward. Okay, at this time I'm going to close the poll. Thank you all so much for giving us your feedback on that. We will use that information to try and, as I said, coordinate going forward. So now at this time we have about 20 minutes for questions and answers. I will reiterate again that these slides will be emailed to everyone who registered for the webinar later in the week. So hopefully that will allow you all to take some more time to proceed through this material in greater detail. So, addressing your questions, Tricia, we have a question for you if you're on the line.
I am.
Great. So if you could help us understand what your perspective is on how long it will take for an organization to be certified after an application is submitted.
Well, I'm assuming from what Socio told me that they had a 2 to 3 week backlog, that really is probably the time that it's taking to get them up in the list. I think, it partially depends on whether the volume is increasing or decreasing now that we're getting started. But Massey, I will try to double check with some of my sources in Socio and see if it's changed at all since I talked with them a week or so ago, and get a better sense of that, so I can let you know that when you do send out follow-up materials, perhaps we can give people an update on that.
Great, thank you. So I have another question for you, Tricia. Do CACs have the same obligation as navigators to serve anyone, whether they be a typical client or not, who walks through their doors?
No. There's a recognition that CACs are not, quote, being paid to do this work, and therefore there would be limits on the level of resources that you would indeed be dedicating to this. And the interesting thing is that the fact that CACs are not required to do outreach really indicated that the federal government felt it would be okay for an organization to only do inReach or serve your existing consumers. And one of the points that we made, as well as other organizations in responding to CIO on this was that, well, if an organization only wants to serve the clients they already serve, then they might not necessarily want to be listed on a website as a resource to the public. And would there be a way for the federal government to distinguish between who's been certified, so that if I was your client, I could see you've been trained and certified, but if I wasn't your client, I wouldn't find you on a list, publicly available. So to that extent, I think there's a little bit of a disconnect. I think it would be obviously hard for someone who receives a phone call or someone walks into their site to say, oh, I'm sorry, I can't help you. But I think that organizations should think through what their strategy would be in that regard if indeed they can't actually help everyone that comes in. By not being out in the community, you won't be drumming up a lot of walk-in traffic, so I'm hoping that this isn't going to be a big issue. But the bottom line is, no, you are not required to serve whatever volume appears at your door.
Okay, great. And I think in a similar vein, we have a question of why does the Navigator training contain so many more modules than the CAC training?
Well, that's a very good question. And by the way, the full Navigator training can be downloaded. I would suggest to you that ideally the Certified Application Counselor training could be more robust. I think the federal government was very concerned that if they made it too extensive, that it would discourage organizations and individuals from helping people. And we know that certainly in this first open enrollment period, first year, whatever, of the exchange, that we need as much assistance as we can possibly get. I think that a lot of organizations that will be certified application counselors already have some baseline knowledge, and I hope that the training builds on that. But I would encourage organizations to think about what else they might want to pursue for additional training. For example, the Center on Budget and Policy Priorities has just launched a new website that, and I'm going to send you the link to it, Massey, so you can include it. I think it's something like Health Reform Beyond the Basics, but they have created a number of taped webinars on things like how premium tax credits are determined, which basically determines what your premiums are going to be, and household composition gets into a lot of the nitty-gritty, so that if there are organizations, certified application counselors, that want to learn more, I think there are more ways to avail yourself of that training by either looking at the Navigator training that's available to download the screenshots, by looking at something like the center has available. The other thing is that I do think that sometimes it is overwhelming, and those of us who have been in this field for a long time knows that eligibility can get a little tricky from time to time, and that beyond that, we're actually helping people to compare health plans and make selections, and some people will be better prepared to do that than others. So I would certainly encourage CAC entities to get to know the navigators, and you've got some great navigators in your state, and be able to potentially triage perhaps the more difficult cases to your navigators or to the FFM call center if indeed you feel like the training hasn't fully prepared you for some of those trickier cases.
Great. And on that very specifically, we have several questions about how long the CAC training is supposed to take.
It's my understanding it's supposed to take 5 hours.
Okay, great. Here's a rather technical question. Is it true that insurance agents can also serve as CACs?
They're not prohibited from serving as CACs, but the question is, why would they want to? Insurance brokers and agents have to go through their own training in order to be a broker or agent within the Federal Exchange. They also can work through the actual insurance companies, the issuers, the QHPs, have a separate web portal into the Federal Exchange where they can assist people in applying for coverage and being determined eligible for premium tax credits. So it seems to me that brokers and agents have a different path to follow, and I'm not quite sure what value is added from their perspective in becoming a CAC.
Okay, great. Is there a deadline to apply to be a CAC?
No, don't think so, and I think this will be ongoing. If an organization, is hesitant for some reason or another right now, but decides, in January they really should be helping out, I don't think there will be any problem with doing it that way.
Okay, we have the next question is citing a recently released CMS Q&A on CAC organizations, and notes that, quote, an organization must apply and become a designated CAC in order to certify one of its staff members or volunteers as an individual CAC. And the question is, does this mean that an individual not a part of the staff of the CAC cannot become certified as a CAC by that organization?
They could be a volunteer. So an individual cannot be certified on their own. They have to be affiliated with a designated entity. That designated entity would have to give them their, quote, designated entity number in order for them to go through the training. That entity obviously has a requirement to ensure that they've screened that individual and that they are making sure they go through the certification process. So you have to be affiliated in one way or another with a designated entity.
Okay, great. For an organization that has a system of facilities such as multiple outpatient centers or areas where they see clients, do they need to complete one application, or do they need to complete an application for each location that they have?
I don't think they have to, as long as they are all part of, the entity that's taking responsibility, if you will, for, again, this, making sure that the screening is done and that the training and certification is done. I think only one application is required. What isn't clear is where, when you look at that application and that section where you can fill out location and hours, if you had multiple locations, it would be very difficult for you to list them all. So I don't think that there would be a problem with the separate entities filling out individual applications if indeed they wanted to be listed on the federal website as individual organizations. But I think that's another question that we can try to get some clarification from CSIO on because it certainly has come up in regard at least to how you would be listed on the FFM. So short answer, I think an umbrella organization only needs to apply, but then what does that really mean for listing all the potential sites where there might be CAC kind of activities going on?
Okay. This is a rather technical and legal question, so we may need to follow up on it, but it's a good one. Does an individual volunteer CAC acting in good faith have immunity from liability under state and or federal law?
I do not think they have direct immunity. There certainly are some penalties for disclosure of private information. So I think the question is broader, though, than that. Immunity from if someone chooses a plan that doesn't end up working out for them, can they sue that individual? And so I think this is probably something that requires scrutiny by someone who understands liability better than I do. I'm not an attorney. Certainly, there's been a lot of discussion about what insurance brokers and agents have something called errors and omissions insurance. Navigators are not required to have that, but a lot of people have suggested that navigator entities, and I think this probably goes for CACs, are likely to have some kind of professional liability insurance, have some kind of insurance that indemnifies their volunteers as well. So I think it would be better to sort of focus on, from the organizational perspective, what protections the current insurance has for their volunteers and staff. But I do not think there's any direct immunity in the federal regs from anyone who is assisting someone.
Okay, thank you. You were talking about disclosure of information and things of that nature. What are the reporting requirements for CACs?
If you're talking about reporting requirements to the federal government, I don't know that we know that yet. And certainly when you go to assist someone, there will be and again, I don't know the whole story here, but either the CAC designated entity number or perhaps your own certification number would be attached to an applicant. So when you help someone fill out the application, there's a spot where you basically are saying, I helped this person, and here's my ID number. And the federal government will be able to track some of the information in that regard. I do know that navigators are going to have other reporting requirements, but I have not specifically heard of any reporting requirements for CACs. But we can double check on that one as well. I wouldn't want to say there aren't any.
Okay, thank you. This might be a good time to bring Kathy May into the conversation. We've gotten a question. There have been questions concerning how long it will take. There is also a question of whether there are any CAC organizations in Virginia already that have received approval. And Kathy, you may be able to speak to that.
Thank you, Massey. I don't know if they've received approval yet, but I do know of a couple organizations at least that are planning to be CACs. One is in Northern Virginia called Northern Virginia Family Service, and they have a network of volunteers already, which they will be, I believe they're training 40 of their volunteers to be CACs. Another organization that I know about that is in process is Java Cares, which is in Charlottesville, and it's the Area Agency on Aging in Charlottesville. And they have a really large network of volunteers that already do all kinds of outreach regarding Medicaid and FAMUS and CHIP enrollment. So they're going to be training a lot of those volunteers to be CACs as well. There are other organizations that are thinking about it. There's one in Martinsville called Contact Phone Line, I think, and they are also interested in having a network of volunteers that will be CACs, and I'm hearing about new ones every day. So we are going to be adding that kind of information to our website, so that in addition to it being on the healthcare.gov or those websites, it will be on our website eventually, but we just are waiting until some of these final pieces fall into place, like locations, phone numbers, that kind of thing.
Great. Thank you, Kathy. So jumping back to Tricia, we have a question of when will the training officially open for CACs to become certified?
It's my understanding it's ready to go now. I have not actually seen the link to it. I don't know if it's sort of a hidden link that once you get your designated number that you then have access to it. But by virtue of the fact that they've already put the screenshots up on the web and the link that we gave, I think the training is good to go.
Okay, great. Thank you. So I might jump in and answer a few questions myself rather quickly, and Tricia, you help me clarify in case I misspeak. We have a question on whether you can be both a CAC and a champion for coverage. As I understand it, these are not mutually exclusive, and there are lower thresholds to becoming a champion for coverage.
That's absolutely right.
Excellent. Okay. So we have an interesting question for a group that serves multiple states. What is the process for that application? You mentioned that a health system that has multiple sites may not have to apply more than once. But what if I am based in Virginia and also Tennessee, which also has a federally facilitated marketplace?
That's a good question, and I am only going to take a guess at it, but I think it's a good guess, and that is that you should apply separately for each individual state. And the reason for that is the marketplace will in some way always be giving someone a different view of the website based on the state that they are in. And that's, when you think about it, that makes a lot of sense. So for example, Virginia's going to have different QHPs than Tennessee has. Virginia has different contact information for the Medicaid agency than Tennessee has. So I'm assuming that it's fairly early in the process as a consumer where you are interested in information that you identify yourself from a particular state, and that the website then focuses on information for that state. And to that extent, having separate applications that would be attached to the state would make sense. I know that navigators were required to file separate applications, or at least submit separate budgets for separate states. So, but we can double check on that one as well. These are some really good questions that I haven't heard before. So I'm glad we can get some new things and go find them out for folks.
Fantastic, thank you. Fortunately, we have a lot of excellent attendees who have actually provided us some on-the-ground feedback, including some community health centers across the state that anticipate doing outreach and enrollment work, and they have applied for CAC status. We also know that in Northern Virginia, one of the FQHCs has actually received their CAC number and have started reviewing the training available to them. So that process is moving along, which is good to know. That's
right. Well, what happened is that all federally qualified health centers were offered additional dollars. They had to apply for it in order to boost their enrollment services, and it is my understanding that their training is the same training as CAC's, that basically they are being told to go through the CAC process in order to comply with their grant requirements.
Wonderful. Thank you so much. So we have answered as many questions as we possibly could. Many of the questions are very detailed that we're receiving and are wonderful questions. What I would like to do now is to make sure that all of you have the contact information for myself, for Tricia Brooks, and for Kathy May. We would be very happy to work with you, especially if you are an organization looking to become a CAC, or if you're an individual looking to connect with a CAC entity. We are looking to facilitate that, and certainly there is a great need for organizations and individuals in this work. That applies to all parts of the states, as well as to very specific subgroups that may need additional assistance. So at this time, I'd like to thank Tricia Brooks and Kathy May for attending the webinar. It was really helpful to have Tricia, your expertise, and Kathy, your understanding of all that is going on around the state. As I mentioned before, these slides will all be sent out to people who registered for the webinar, and the slides will be available on the Commonwealth Institute's website as well as the website of Virginia Consumer Voices for Healthcare. At this time, I'd like to conclude and say thank you again for attending, and I hope you all have a great day.